We've heard about the importance of partnership working, that interoperability isn't just about technology, but it's about the integration of our services and knowledge sharing. There's a need for new culture for our housing, health and social care services to help our collective services move forwards through this next phase of the pandemic, but also to plan now for the challenges ahead. We've heard about the proactive and preventative agenda and the work that TSA are doing with ADAS and the role that tech plays within this. But I think most importantly, we need to be mindful that our citizens need to live lives, not services. We can develop our partnerships, our services, we can develop our workforce, but it's paramount that through our shared learning, we develop good quality services and practices. In providing these safe, good quality services, we've been working with organisations in a variety of ways, and I'd like to just share with you some of the exciting work that we've been delivering recently. Careline Support Limited have been working really hard to develop a new call handling service to enhance their existing housing service provision. They've managed to recruit a team of call handlers who, with the exception of one, were new to the technology-enabled care industry. At the same time, they also became members of the TSA and are also working to become an accredited service, all during a pandemic. Their drive, their determination and their commitment meant that they were able to commence their service as planned at the beginning of September last year. We've also been working with the ambulance service. It was recognised that there was variation in how TSA members use the emergency services across the UK, and that this can impact on how emergency calls are triaged by the ambulance service. In addition, ambulance crews attending emergency calls from tech call handling services could be improved to inform the monitoring service of the outcome of their attendance. So we've taken steps to address these issues. Firstly, Tech Quality implemented a new standard that requires technology-enabled care call handlers to continue to monitor a service user's welfare where a call has been passed to a responder and until that responder arrives. Following on from this and working closely with the ambulance service, a support tool has been created to offer guidance to technology-enabled care call handlers when passing a call to the ambulance service. Our monitoring services are not medical triage specialists. The role of the monitoring service is to conduct the initial assessment and then coordinate an appropriate response at the service user's time of need. This interactive support tool will guide technology-enabled care call handlers on the initial key questions that they need to ask before handing the call to the ambulance service. The aim is to improve communications between our two services and always to ensure that a positive outcome is achieved. For the duration of the project, our alarm receiving centres will have a community specialist paramedic appointed to them. Their role is to build relationships between the ambulance service and our monitoring services, to identify, clarify any further terminologies that we may need to add to the tool to help our call handlers understand the different phrases and terminologies that are used. They're also there to support organisations in implementing this support tool and to identify any locally defined pathways that technology-enabled care may be able to utilise for future development. The ambulance service are also building their knowledge of technology-enabled care services. They've been encouraged to press a person's pendant to advise the monitoring centre that they're in attendance, and then will press it again as they leave the property to inform the outcome of the visit. Then finally, we've been working with Manchester City Council, who'd identified that around 3,000 people have their care funded by the local authority. So with very few self-funders, they needed to identify ways in which they could reduce and prevent high-cost admissions to hospital, residential and nursing care. They're investing in the development of their workforce to ensure that their frontline staff have the right knowledge and the right understanding to support the citizens in their communities. They've developed, they've developed an Arm Manchester. This is a shared vision owned by residents, workforce, businesses and volunteers in the city to change the relationships that they have with the citizens and each other to empower and enable people to be more independent and focus on what matters most to their citizens. We've been working with Manchester to deliver tech awareness training to 400 frontline staff to ensure that all staff have a good understanding of the technologies available to them through their My House Rules brochure, but also so that they're able to guide and advise citizens on the wide range of technologies that are available to them and the benefits that they can bring, not only by to promote their independence, but also to support the families and informal carers.